Hello, my name is Marcus Chavez and I'm with IFARA TV. Today we will be cablecasting segments of the press conferences that were held during the 22nd CROI, which is the annual conference on retroviruses and opportunistic infections, which took place in Seattle, Washington this year. This segment will be presented by Susanna Naggie, who is with Duke Clinical Research Institute in Durham, North Carolina. Susanna talks about the ION-4 trial, which assesses the safety and efficacy of using elidipavir and sofosbuvir in a 12-week regimen in patients co-infected with HCV.
Susanna.
So my name is Susanna Naggie. I am from Duke University and the Duke Clinical Research Institute. This morning I presented the ION-4 trial, which assessed the safety and efficacy of elidipavir and sofosbuvir for 12 weeks for the treatment of hepatitis C in HIV-infected patients. So this was a single-arm, phase 3 multi-center trial. We enrolled 335 HIV-infected patients. 327 of them were genotype 1 infection, and 8 of them were genotype 4 infection. These patients all received 12 weeks of elidipavir and sofosbuvir without interferon or ribavirin. So ultimately, our study cohort was, I think, highlights were 34% African American, or 115 self-reported Black patients. We had 185 patients who were previously treatment experienced. Of those, 29% had failed prior protease inhibitor interferon ribavirin regimens. 13 patients had failed a previous sofosbuvir-based regimen with ribavirin. 67 patients were cirrhotic, and specifically 47 were treatment experienced and cirrhotic, which has kind of been identified as one of the more difficult to treat patient populations. So we reported 96% cure rate across the study in the intention to treat analysis. And this was the same for genotype 1, which was 96%, regardless of 1A versus 1B. And all 8 genotype 4 patients were cured, which has been suggested in other trials for this genotype with this regimen. And we really didn't see any difference when we looked at patients who were treatment naive versus experienced, or cirrhosis with no cirrhosis. And specifically, those 47 patients who were treatment experienced and cirrhotic had a 98% cure. So only one of those patients relapsed, in fact. So in a multivariable analysis, we did identify that self-reported Black race was the only predictor of lower sustained biologic response. We had 10 relapses and 10 patients, all of those 10 patients were Black. We did pretty significant analyses to try to explore this, as it has not been reported in any other trial, albeit this is the largest Black American representation of any phase 3 trial in HIV infection, and the second largest of any trial in HCV infection, period. So we looked at PK levels of elidipavir sofosbuvir exposures with no explanation, and are doing further pharmacogenomic studies, including genome-wide association and full genome sequencing of all of those patients to explore this. But overall, really exceptional cure rates and a very safe regimen. We had only 14 grade 3-4 adverse events. Only 4 of those attributed to the regimen, and they were really things like diarrhea and nausea. We had 8 severe AEs. 2 of those were hepatocellular carcinoma diagnoses, just highlighting how ill many of these patients are and the severity of liver disease that was enrolled, as well as 2 cases of portal vein thrombosis, similarly highlighting the severity of liver disease in this patient population. I think the most important take-home point with this regimen was that not a single patient discontinued due to adverse events, which we were thrilled about. And overall, recognizing drug-drug interaction studies in healthy volunteers that suggested higher tenofovir exposures in patients given this interaction of HIV drugs and hepatitis C drugs, and higher tenofovir exposures that have been reported in drug-drug interaction studies in healthy volunteers. We did a pretty intensive analysis of renal safety, and really no renal safety signal here. Only 4 patients who met predetermined criteria, and only 2 patients required any change in their tenofovir regimen. 1 was just renal dose reduction, and 1 was a switch. So overall, we were thrilled with these results, and I think this and the ION-2 trial offer great options for patients who are HIV co-infected.